Good morning. First of all, I want to thank you, our media partners, to join us this morning. My name is Dr. Sudhakar Jonnalagadda, President, American Association of Physicians of Indian Origin, representing interest of 100,000 physicians. However, we are here to deal and supporting the critical conditions going on in India, COVID-19. For the last 1 week, AAPI leadership working very hard to support and see how we can able to help the motherland. In a matter of 1 week, AAPI able to raise more than $2 million, which will help to support the nation. We recently acquired some oxygen concentrations and we send it through UPS. We are using SEWA International for distribution as our partner. We are also acquiring more and more. However, this is not enough. This is the time the largest democratic countries like US and India has to help each other. United States, I humbly request President Biden and Kamala Harris, please support the India in a critical crisis. They need raw materials for vaccinations and also for medications and PPE, especially oxygen concentrations, BiPAP, CPAP, and ventilators. I humbly request, and also AAPI leadership going to meet our Honorable Health Minister Dr. Harsha Vardhan Monday, and we're going to discuss with him what they really need at this crisis time. We are doing our best as AAPI point of view, but this is the time the greatest nation in the world, US, should support India. We also requested through AAPI leadership to lock down India so that the infection spread rate will be lessened, which they did in the first phase, in the first time. But I think this is the time I think they should consider looking into that and lock down India so that the spread of the infection will be much less, and hopefully it won't, and people may not get much sick. And also vaccination is very important, and trying our best. AAPI leadership going to meet in Washington to the lawmakers, particularly see if we can able to meet the Ms. Kamala Harris, the Vice President, see if we can able to help us to ship AstraZeneca vaccination to India, which is readily need right this time. So we are, as AAPI point of view, we are doing our best, our leadership, but this is the crucial time. The United States support India is really needed time. And thank you again for your assembling today. Thank you.
So what kind of discussions you are going to have with Harsha Vardhan, Health Minister?
Well, we're going to have a discussion with what they really need, most important right now, what they need oxygenators, or they need any nasal cannulas, or they need any step-down respirators like BiPAP, CPAP machines, So, see, it is what we are doing is a drop in the ocean. Okay, I think we're really requesting going to Washington D.C. this week, coming week, and see what we can do for the AAPI point of view. Request the government to see if can able to help us in need.
Sir, how this oxygen concentrator are going to reach the people? And is there any way if any needy can reach us once they reach?
Yes. Again, we don't have a manpower to distribute in India. Okay. What we are doing, we are buying and we are using our partner SEWA International to help to distribute there. And they have a nice plan because they work at the ground level. And what they discussed to me that, initially they are going to help the patients who are in the what you call isolated areas in India, okay, where their patients who are not badly sick go to the hospital, so they are the required oxygenation. They are going to supply first, then they go to the hospital, government hospitals. Okay, we are not doing anything for private hospitals or any other private thing.
Okay, are you building a bridge between US government and Indian government?
Yes, yes, that's what we are planning to do. That's what we are trying to go capital coming week.
Okay, so that is the reason you are visiting Washington D.C.
The main reason is, we requested to ship the AstraZeneca vaccination. That's what the government of India also wanted, vaccination.
Okay. So other than oxygen concentrators, so the pulse meters also in shortage in India. That is what. Are you planning to do anything?
Absolutely. Actually, we are working on that to buy bulk pulse oximeters, and that is our next assignment.
Okay. So as far as the manufacture of that oxygen concentrators, so probably I don't know how many pipes they are giving, because once one patient uses, second patient cannot use, right? So are you planning for any accessories like anything?
Right. The nasal cannulas we are planning to buy bulk also, and we are also working on buying some ventilators. Okay. We are working with one of the company in India, one company in England. So we try to see whichever. This is the time everybody jack up the prices. Okay. So we are doing our best. We can able to, if we buy some bulk, hopefully they'll give a good deal so that we can ship it in bulk.
Okay, so doctors made very good role to bring America back into normal position almost now. So what do you think in the current situation, looking at in India? So when the things will get settled? Just an idea.
Very hard, very hard. We don't know, because as I just alluded that lockdown is the best answer right now, so that the infection spread will definitely less. And AAPI point of view, the teleconsultation one platform we started a long time ago. But we enhance the platform so that you can reach more rural Indian patients, and also physicians. We can need to have any questions, interact with the US physicians. So I think that will be discussed by our officers as they go. But at this point of time, essentially, whatever organization point of view, will do our best. And also, I think it's the time. I think the two democratic nations should help each other.
Thank you. So one more question. The Indian variant already reached in US and all. Those kind of news are coming out. So any views on that?
Well, that's why that's very important, because we don't want to have another wave here with the mutant virus. Because that will collapse here also. So that's the reason why vaccination is very important. Okay, and prevention is better than cure, as the lockdown.
So people in America stop wearing masks nowadays. So any suggestion? I mean, is it good idea to not to wear?
Well, it is not at all a good idea. Okay, because we don't have until unless we have a concrete medications. The prevention is better than until we have some idea. Because still we are debating what is the right way to treat these patients. And definitely mask is definitely important. It protects the life.
Okay. So are you going to suggest the White House to retweet, to wear the mask kind of thing?
Yeah.
Well, I think that's why the physician I would definitely tell them.
Thank you so much.
Would you highlight a little bit on the work which AAPI has done towards COVID-19 recently, especially for India, and the upcoming events which you all have lined up as emergency?
Say it again. I'm sorry.
Would you highlight a little bit on the work which you done with SEWA just recently, and what are the upcoming work which you guys are doing on the spot projects running on?
Yes, I think we last April 29th actually, with SEWA we shipped about 1,000 units of oxygen concentrators, and that will be distributed this week hopefully through SEWA, because that's what our officers and the committee decided. And second thing, we acquired another 500 units. We plan to buy more. And concentrators we are already looking for, and we have somebody going to offer. But again, we're going to send another 1,000 and soon. And after talking to Dr. Harsha Vardhan tomorrow, and definitely we'll procure more and more requirements like nasal cannulas, pulse oximeters, and BiPAP machine, and CPAP and ventilators, depending on whichever they need right now.
Is AAPI working with any kind of associations of doctors back in India to guide and to help out and in any way?
Well, we particularly not partnership with any doctors organization there, but we have association with the different countries, the different states. If they need any help, we are offering the telemedicine platform now.
Okay.
Dr. Sudhakar, apart from India, are you planning to help any other countries where most of our Indians are also there?
Well, if our donations adequate enough, definitely do that. Right now our goal is India.
Thank you.
Are you sending any manpower or volunteers on a Doctors of India?
Yeah, we decided on that, and some of the physicians want to go there, but the government of India, they're not asking any of the foreign physicians to come there because of the legality.
Anything else you guys think? Anyone else?
Let's go with one.
Yeah. Is Dr. Sreeni Gangasani. I'm a cardiologist locally in Atlanta and a current chair for upcoming Atlanta convention and past vice chair of board of trustees, also director for this GAAPI free clinic and past president of GAAPI. Thank you for giving this opportunity to let our views to know to the people. Appreciate AAPI leadership team for coming here and doing a wonderful job raising the money and providing all these ventilators and oxygen generators, concentrators to Indian community. So also really appreciate AAPI team, community coming together in a very short time to get all the money raised in a short period of time to help. I'm just going to tell a few things about from my point of view. So one is that every 6th Indian patient is being treated by an Indian doctor in United States. So we are on the forefront for treating this COVID pandemic in the last 1 year. So we learned a lot in the last year or so. We are teaching our brethren in India and all over the world through the webinars through our leadership team provided. So they're teaching other people and we want to learn from each other's experiences. So I think that AAPI has done a wonderful job in the last 2 years producing these webinars. And from a telehealth platform point of view, so we have 3 telehealth platforms AAPI we're working with. I'm more closely associated with eGlobalDoctors.com, which is a new platform. We were working with to get this started next month, but because of this current situation, we opened up to provide free consultation to Indian patients through our platform. So we have a lot of physicians, not only from United States, United Kingdom, Australia, New Zealand, we're working together so that because of the time difference, so we can have a lot of people make use of this. The goal is to reassure people so that they don't need to go to the hospital if they don't need to. If somebody needs to go to the hospital, we need to go to the hospital. So by having these telehealth consultations, we want to talk to the patients to see who is sick, what the saturation is, what the heart rate is, and how the symptoms are so that we can judge them with our advice so that we can avoid a lot of unnecessary visits to the ERs and then clogging up the ERs. So that is the main goal of this telehealth platform. So we are starting from 8 o'clock our local time, Eastern time, until 11 o'clock at night every day. So that's India, like 6 o'clock to 9 o'clock in the morning, so that we have a population of physicians volunteering, help the Indian population. As more volunteers to come, at the same time, the UK volunteers come to change the timings. So it's a work in progress, and also protocols are changing quite a bit. So we'll have one everybody to teach before we talk to, and then help other physicians, because a lot of these physicians don't take care of the COVID patients. We're giving them advice, like our AAPI leaders alluded to. We're going to need to talk to Indian Health Ministry to see whether we can work without the guidelines of the licensure and stuff, if we can liberalize that so that we can have more physicians willing to come back. And the third thing about Atlanta, we'll have our next 39th convention at Omni in Atlanta from July 2nd to 5th. So we are doing a small convention with all the CDC precautions, with the guidelines what is going to be. Hopefully we can have a nice convention. I invite all the people who are vaccinated and can register and come to the convention in the July 4th weekend. Be safe and be healthy.
Especially many people who are getting cold, they're getting cardiac arrest and they're dying. So
that's a good question. COVID affects about 40% of the people will have some kind of a heart condition. Is it heart rate goes lower or form both in the lungs, the heart, as well as in the leg veins, which can cause the cardiac arrest through a thrombosis in the heart or through the pulmonary embolism, blood clots. So I think the treatment is very important. Even in spite of the treatment, sometimes the heart muscle can get weaker, what we call cardiomyopathy. So I think people need to monitor. We still a new disease. We still don't know the long-term consequences of these problems, what we're going to face. I patients are still not that much. But the good thing is majority of people are coming back to normal. I think it's a matter of time to do more. So, as I think, is less than 0.04% or less. So the benefit is humongous. I think when somebody gets a COVID, the risk of dying is somewhere between 1 to 3% depending on the comorbidities. So versus the benefit outweighs the risk any day, especially people with the comorbid conditions. Yeah, there is a risk involved. There is a risk driving on highway, but we are still going because we cannot sit home. So that's what my point is. I think you need to look at the risk versus the benefit. When the benefit outweighs the risk.
Any symptoms you can tell people what would be?
So it depends on the it depends on the weight. The blood clot is in the leg, the blood clot is in the lungs. Thinness point of view, I think people who have elevated levels of enzyme, they benefit from taking the blood thinners for a short period of time. They can take the blood thinners so that they will prevent the blood clot, especially who are a lot sicker, and increase the activity as much as you can. When you are lying down in the bed not moving too much, that's when it causes the blood clots, because the stasis with the stagnation is what causes the blood clot. So you need to get up and walk around, do as much as you can sooner than later. And in the sicker patients who cannot do the medications to prevent the blood clots, that kind of medications help to prevent those blood clots. But use the telehealth platforms and take the questions. It's a free consultation. Every day can go to eglobalDoctors.com, and there is a Zoom link. They can just join in freely to get the questions answered.
And I want to congratulate the AAPI for selecting SEWA International as a logistic partner. They are very nice. It's a nice organization. They have a reach, especially in the pandemic. They reach out to every corner across the world, not only in India. So any country. So that is a good idea. You went to SEWA International.
We're also planning to partner with other organizations to reach even Red Cross, and some people might have consistency with one organization, so they can use other organizations. So we're reaching out to every partner that are compatible with our philosophies and our professionalism and equality. So we're working with all the groups. SEWA came on very quickly with us, and we're very happy. They're one of the best.
We're also working with the CDC team, volunteers, so they're helping us to do the telehealth platform, along with SEWA Doctors are also helping to put together. It's just a team effort. It's not a one person. There are multiple platforms out there. I think people use whatever they can and help with whatever they can volunteer with.
I think hats off to you all, doctors, for putting this all together and working relentlessly. And we also want to partner with you if you need